In this video, we're going to be taking a look at the sacrum, as well as the individual parts of the sacrum and what it articulates with. So this bone by itself looks a little out of place, so I'm going to give you an idea of its relation in the human body. This is the proximal end of the sacrum up here. This is the distal end down here. Superior to the proximal side of the sacrum is going to be the lumbar vertebrae, which rest at the very bottom of the spine. And inferior down here to the distal end, you're going to have your coccyx or your tailbone. And being that the sacrum rests right between the upper and the lower body, this is going to be a location where a lot of the weight from your abdomen as well as your arms is transferred down to your lower body and your legs. So this location for the sacrum, and the fact that it is such a tough and resilient bone, means that it's really in an optimal location in the human body. Now we're looking at the sacrum from an anterior perspective. So what we see here is known as the pelvic surface, and originally there were 5 separate vertebrae where the sacrum currently is located. Although these bones are now fused, it can be seen that we had 5 separate bodies of the vertebrae, we had 5 transverse processes, and as well as the foramina that are created by the transverse processes. So starting at the proximal end, we have this first ossified vertebrae, and this lip that sticks out is known as the sacral promontory. As I continue down, each additional lip is known as a transverse line. And here, all these transverse processes that come together ultimately form the ala, or the wing, of the sacrum. Had these vertebrae remained unfused, these holes would be known as the transverse foramina. However, because the vertebrae are fused like we just mentioned, they are now known as the sacral foramina. And these sacral foramina are important because it is through these holes that we have passage for nerves and we have passage for veins, but most importantly, the spinal nerve root is what passes through these sacral foramina. Here, from a lateral view, the sacrum appears to be very broad superiorly or towards the proximal end, and almost tapers down as we get to the distal end of the sacrum. So right here, we have what's known as the auricular surface. The auricular surface is very important, as this is where the sacrum articulates with the ilium of the os coxae to form the sacroiliac joint. And it's at this joint that the upper body is joined directly with the lower body. As you notice here, when we look at it from this lateral perspective, is that the bone curves throughout, and this angle is known as the inferior lateral angle of the sacrum, and this part is often very distinguishable between a male and a female skeleton, and we'll talk a little bit more about that later. Lastly, we have a posterior view of the sacrum, and from this posterior view we see the dorsal surface of the sacrum. As I mentioned earlier, the sacrum is composed of 5 separate vertebrae that fuse together and ossified into one single bone. If these bones were still separate, then these ridges that we see here would be known as the spinous processes of the vertebrae. However, because these vertebrae are fused, these spinal processes are called the median sacral crest as a whole. Another noticeable difference between the sacrum and unfused vertebrae is an absence of a vertebral canal, which should be located up here. In the sacrum, we simply have what is known as the sacral canal, and down the sacral canal, veins and certain nerves will pass through here, and ultimately exiting at the inferior portion of the sacrum, known as the sacral hiatus. What is very interesting about the sacrum is that, unlike most any other bone in the body, the sacrum is sexually dimorphic, meaning that it is shaped slightly different between males and females. Overall, the female sacrum is going to be shorter and wider than the male sacrum. In addition, it's important to note that as it sits in the body, the female sacrum is going to be directed more obliquely backwards, with the greatest amount of curvature occurring towards the distal end. In a male sacrum, you're going to notice that the inferior lateral angle, the curvature is more gradual throughout the bone. And this is evidence of how The sacrum has adapted over the years for procreation purposes and allowing to give birth easier. Given the sacrum's position in the body, it seems that its main purpose is to resist stress and to transfer weight. So does the sacrum move? Well, it does move, however, very slightly. When it does move, it will rotate along the sagittal plane, and when a person will bend forwards, the superior end of the sacrum will fall backwards very slightly, and likewise when they bend backwards, the sacrum will move forward very slightly in the same manner. This about concludes our discussion of the sacrum. It's important to remember the sacrum's position in the human body. It's located just inferiorly to the lumbar vertebrae as well as superiorly to the coccyx. The sacrum is also sexually dimorphic, and simply looking at a sacrum in a skeleton can be a very helpful indicator as to the person's sex. The sacrum does protect organs, however, its key purpose is to give us locomotion as upstanding vertebrae by transferring body weight from the upper to lower body. Rarely, if ever, will the sacrum be damaged in an individual. In fact, sacral damage will only be seen in cases of extreme trauma or in the presence of someone that has rheumatoid arthritis or osteoporosis, which aided the injury. Not only is the sacrum a protector of other body parts and organs, but it is well protected within the body itself.